Welcome to Mindfully Integrative Podcast with your host, Dr. Damaris G. Mindfully Integrative is a podcast discussing ways toward mindfully incorporating integrative health into our lives. This podcast will have informative resources, fun topics, interviews, and discussions relatable for today with a true mindful perspective in a mind-body, holistic life approach.
So with women's health and the body, we have many of different metabolic syndrome issues, and things that come up are actually related to metabolic and a possibility for women. One syndrome that a lot of women that have had, in addition to endometriosis, this one is called PCOS, or polycystic ovary syndrome. It's not a disease. It's genetic, but it also is metabolic. So it depends upon what the underlying cause is. Again, with a lot of things are about what's the underlying issue. You don't just have the name of something. You have to understand what is the reason. So I can tell you PCOS, and someone will say, oh, I just have a lot of ovary. I have an increased amount of ovaries, cysts on my ovaries, and that's what I have, and that's it. No. There's actually 4 different types of PCOS, and initially the symptoms that come with it are cyst on the ovaries, painful periods, acne, hair loss, infertility. Obesity is always usually related, and I'll explain to you about that. It's only about 50 to 60%, but half of the population, a lot have this PCOS for women. Prolonged periods, chronic pelvic pain, chronic intercourse pain, hypoglycemia, hyperglycemia, diabetes, hypothyroidism. Why are these related, and why are these symptoms? Well, until you understand the type of PCOS you have, you won't know how to treat it. So first off, there's 4 different types of PCOS. So the first type is insulin resistance PCOS, and a majority, I would say this is related to the obesity and the diabetes. Now, obesity and diabetes are just names of disorders, but they're not the whole diagnosis, right? Your full diagnosis. They're just part of the equation. So think of it like insulin resistance has to do with there's an overproduction of insulin and your body's not able to get rid of it. And it has an uptake of that glucose, which is not able to get rid of, and it then stores it. In turn, this metabolic syndrome has excess insulin, which then turns on different things in the body. In this case, for PCOS, you get a high intake of insulin, which then will cause these cysts in the body due to the hormones are changing. And so what happens is, for these individuals, they have a lot of problems with weight, a lot of abdominal weight in the stomach, sugar cravings, fatigue, excess hair growth, a lot of the acne and such. Now, treatment for this, again, it depends upon what your PCOS. So in this case, if I'm treating you for PCOS for insulin resistance, first I'm going to check your A1C, I'm going to check your fasting glucose, and I'm going to say, why do you have this, and what can we do to get it to a normal level? Now, there are sometimes people have multiple PCOS, but we're going on type 1 insulin. Well, you don't say it's not type 1, but the first type is insulin resistance. Now, how do we treat it? Well, it's because it's insulin resistance means that there's an excess of sugar. So I want you to modify the sugar. I want you to have regular exercise. I want you to lower high sugar foods, processed foods. I want you to reduce your stress, keep your sleep down, and work on, there's some supplements that can be helpful. Different types of supplements that can be offered. Magnesium, because it's a vasodilator. Inositol, which is helps with the overall production in ovary hormone health, and berberine, which is good for blood pressure too, and a vasodilator. Now, there's a second type. So the second type of PCOS is post-pill or pill PCOS. And this has to do with when you're on the contraceptive pill. So that is Yasmin, Jen, any of those with hormone progesterone use. Now, with this actually can be reversed pretty quickly once the pill has been stopped. So it takes, well, not quickly, but about 3 to 6 months worth of time. And this can also cause weight gain and brain fog, but there's not an insulin resistance. Some individuals, though, will have post-pill, having the pill. In addition, they've had insulin resistance or the first one that we discussed, the insulin resistance PCOS, because their diet is not good. So they have that those issues. So it could be a combination of these two. Usually I see those two together. Supplements, again, that can be used. Now here we're talking about the pill. So here, when you are on the pill a long time, I had been on the pill for quite some time in my life, and you have a deficiency in magnesium, vitamin E, vitamin B, vitamin B12, all the Bs, and zinc. So majority of the time, those would be where I'd want your micronutrients are low. So in this situation, we want to increase it because hormones, when you're taking oral contraceptives for long period of times, you do have depletion. In addition, you also have some calcium depletion too. So things that are helpful, there are some good herbs like ashwagandha, peony, berberine, you can also use again, and anything to kind of lower that androgen effect within the body because that has been elevated. And then, of course, sleep and stress management. Now, the third kind is pretty common too. It's called adrenal PCOS or stress PCOS or the overall HPA axis need. Now, what this is because it's an abnormal stress response within the body. They say about 10 to 20% can get this. I think it's a little bit more. It really depends upon what's going on in someone's body. And you can really tell by this because they have really high levels of cortisol and really high levels of DHEA. So when someone comes in and says, oh, I have some weight gain, but, and you look and they have high testosterone, high DHEA. This is a one where when you go to the doctor, most of the time, this is when they get that diagnosis. They'll say, oh, you have PCOS because your testosterone is high, your DHEA is high, and your adrenals are overworking. Now, it's not that your adrenals are just overworking. It's just that the excretion of a hormone in the adrenals has been excess. That's why you have high cortisol. What it means overall is that the endocrinologist may not always give you the right formula to help get you to the right message. So the things that are helpful in this situation is because it has to do with the DHEA and the testosterone. You can take some herbs and supplements to help with lowering of that. Ones again, there's adrenal support supplements that can be used, magnesium, all the Bs, and a vitamin C for immune support. Now, again, we're talking a lot about trying to lower that cortisol level. So you need stress management techniques, stress transformation techniques that I emphasize quite often. If you hear me on this podcast and on this show, yoga, meditation, and mindfulness, exercise regularly, journaling, or some sort of outlet to get your thoughts available on paper so that this excess energy and things are settled and that you can get your mind, body, and spirit to get those hormones and that level and settled down. Now, in addition, of course, sleep is such a complete and utter importance in this factors. Why is this so important? Well, I'm going to say between 7 to 9 hours of sleep, the average person should get. Now, I know we're not getting that. In addition, that means quality sleep. So that doesn't mean, all right, I wake up and then I go to sleep and I wake up and I go to sleep and I wake up. I want you to have quality amounts of sleep and longer periods of time. Now, in this situation, these individuals with adrenal PCOS would not benefit from many things of high intensity workouts. They'd benefit from exercise, but not the high intensity, high heart rate, because then what you're doing in turn is you can still kind of trigger the cortisol level. And I talk about this in my book and on another podcast about the stress response to exercise. And the reason this is that if you have high intensity, your body is in turn thinking that back in the day, it's in this fight or flight. So high intensity is excellent for oxygen consumption and for muscle retention and for building strength and lowering fat. But For this type of PCOS individual, if you do it too often, the adrenals are triggered even further. And I'll say the adrenals, but the entire body, brain, um, and HPA axis, hypothalamus, pituitary, and adrenal axis, the brain and gut, they are connected. So when you are doing this, instead of resting and digesting, it's in fight or flight, and it's just not digesting anything. You are just your body is storing because it's afraid it's never going to eat again because you are in starvation mode. But technically you're not. It's just your body's in that stress mode. You would avoid most caffeine in this situation for most adrenal individuals. Now, 1 cup of coffee, meaning about 6 to 8 ounces of coffee, is not negative. You can actually use this with like lion's mane or ashwagandha or some herb once a day. But when you go over the 2, 3 cups, then for these individuals and for anyone, it can be an excess. Herbs that are also very good are withania, rhodiola, licorice. I always say ashwagandha because it's an excellent herb. And supplements, again, my favorite, magnesium, bees, all the bees, and the vitamin C for inflammatory response. Now, the third one is inflammatory PCOS. I'm sorry, the fourth one is inflammatory PCOS. Now, what is inflammatory PCOS? Very similar to other ailment in the PCOS realm, but the symptoms, like when you're testing, is going to be different. So you're not going to have a DHEA or testosterone elevation. You're going to have more joint pain, headaches, fatigue, eczema, IBS. Why? Because your body is an inflammatory, meaning that it has this high inflammation within. This could be caused, so it's again about what are you testing for? It could be caused by also sugar, but in addition, you want to do testing wise CRP, which would give you an inflammatory marker. That's just one area. Then you'd want to test for sugar because you want to see if is it in addition. So like insulin resistance and inflammatory would go hand in hand too. Doesn't always happen, but sometimes it does. You want to see what the food sensitivities in an individual are. There may be things that trigger that individual, stress and anxiety that have come up for that person. What is their lifestyle? What is going on? Their overall gut health, because the gut and the brain all are connected. Brain, gut, and are absolutely part of your immune system. And then you're kind of looking at the overall, like I said, again, a food sensitivity, what is going on? And then in addition to that, inflammatory response, what you're putting in your body, is there also something else underlying? There could be infection, there could be parasites, there could be toxins, there could be environmental things. So all of these can be triggered by that, but in this one specifically, that may be a factor. In addition to the B vitamins and the always magnesium on my top and a multi, another one really effective is omega-3 fatty acids. And that is because the cellular level layer has a phospholipid protein layer. And that layer benefits from the omega-3 covering it so that when it's goes throughout the body, it's kind of like you're oiling your machine and you're oiling the joints enough so that they move smoothly and aren't dried out. The other effective one is turmeric, also magnesium. Now, in this reason is because they're vasodilators. You would like to also lower your salt intake because in the cells you have a potassium and a sodium pump. And when you have too much salt, the potassium pump shuts off and then it eventually will dry out the cells, the outer layer, which then could eventually turn into blood pressure issue, which then eventually could turn into an inflammatory response. So there's many of different parts of this to the equation. There's not just one, but when you have an understanding of what the underlying cause is, it becomes easier. You start to go, oh, okay, I get this. So for more resources and tips, I'll reach out and talk with you soon. Have a great day.
Thank you for listening to the Mindfully Integrative Show with Dr. Damaris Maria Grossman, family nurse practitioner. This podcast is for informational and educational purposes only and is not the substitute for professional medical advice, diagnose, or treat. Always consult your healthcare provider before making changes to your healthcare routine. Make sure to subscribe so you don't miss an episode. If you enjoyed our show, please support us by leaving a mindful review on Apple Podcasts or your favorite streaming platform. Interested in being a guest or more information? Email us at info@mindfullyintegrative.com. For resources mentioned in the show, visit our website at www.mindfullyintegrative.com. You can also connect mindfully with Dr. Damaris on her social media links found on the site. May your strength and peace guide you to find a mindful way every day. Namaste.